Let's begin with cranial nerves, moving in numerical order. Cranial nerve 1. Ask the patient to close their eyes, then present an alcohol swab and ask them to identify the smell.
Crystal, I'm going to test your smelling, so I'm going to have you close your eyes and then tell me what you smell.
An alcohol swab.
Cranial nerve 2. We will be assessing visual fields, accommodation, and PERLA, which stands for pupils equal, round, and reactive to light and accommodation. Shine a light in the patient's eyes to see the quick reaction of the pupil.
So I'm going to shine a bright light in your eyes. Great.
Next is accommodation. Accommodation is the eye's ability to adjust its focus from a distant object to a near one. So ask the patient to focus on a distant object, whether it be something across the room or possibly your shoulder, which will help the pupils dilate. Then ask them to shift their focus to a near object, usually your finger or pen light, held about 3 to 4 inches in front of the nose. Observe the pupil's restriction and convergence. This means the move inward towards the nose motion. This is normal accommodation response.
Can you focus on my ear here? And then focus on my pen.
Measure the pupil size. On pen lights, there can be a graph that can be used. Just slightly put it up to the patient's eyes and then try to get the correct measurement. Cranial nerve 3, 4, and 6. The assessment is the 6th cardinal field of gaze. Ask the patient to follow your finger or pen light with their eyes only. You are checking for smooth, coordinated eye movement and any nystagmus. This can be done with the H method or the cat whiskers method.
And focus on my pen here. Great.
Cranial nerve 5. You can use a dull object like the tip of a swab and lightly touch the areas of the face on both sides, the forehead, cheeks, and jaw. Or by performing your buccal swab collection, if you do bilateral cheeks, this was also a correct sensory response.
So you're going to collect a swab from the inside of your mouth along both sides of your cheeks, and let me know if it feels the same on both sides. It feels the same.
Cranial nerve 7, just ask the patient to smile and raise their eyebrows. You're assessing facial symmetry and motor function. If movement is restricted, ask whether they've had any cosmetic surgery or any medical injections like Botox.
Can you smile for me really big and then raise your eyebrows?
Cranial nerve 8 is the hearing nerve. Perform the whisper test. Stand behind or on the side of the patient, mask one ear by rubbing your fingers near it, and whisper a number or word in the opposite ear. Then repeat for the other side.
So I'd like to test your hearing. If it's okay, I'm going to get a little bit close to you and rub my fingers together on one side and say a word on the other side.
Okay.
Okay.
1. 5.
And did they hear sound the same on both sides?
Yes, I did.
Cranial nerve 9 and 10. Start by asking the patient to open their mouth wide, tilt their head back slightly, and say ah. You're looking for the uvula to rise midline. Next, use a tongue blade to gently depress the center of the tongue, avoid triggering a gag reflex, and ask them to say ah again. Confirm that the soft palate elevates symmetrically.
Can I take a look inside of your mouth?
Sure.
All right, say ah. And then I'm going to do the same. I'm just going to press down on your tongue with this tongue depressor, if that's okay.
Okay.
And say ah. Perfect.
Cranial nerve 11. Ask the patient to simply shrug their shoulders and turn their head from side to side.
Can you shrug your shoulders and then side to side? Any pain with movement?
Nope.
Cranial nerve 12, ask the patient to stick their tongue out.
Can you stick your tongue straight out? Perfect.
That covers the cranial nerve assessment. However, additional assessments can be done when a patient reports strangulation. One would be a carotid artery assessment. Before auscultation, swab the sides of the neck to reduce contamination and collect DNA. Then, using your stethoscope, place the bell gently over the carotid artery, one at a time. You will be listening for bruits, which can indicate turbulent blood flow or narrowing. Never palpate carotid arteries.
So next, I'd like to get a swab from your neck. I'm going to be using a little bit of saline, so it's going to feel a little wet. Let me know if you have any pain. And then I'm going to take a listen on both sides of your neck. It's a little cold. Take a deep breath and hold. Good, and breathe out. And one more deep breath and hold. Great, thank you.
Finally, you can assess for motor strength. For arm strength, ask the patient to resist you as you push and pull on their forearms.
You hold your forearms up and then push away and pull back.
Next, grip strength. Have the patient squeeze your fingers on each hand.
Squeeze tight. Good.
With those two assessments, remember that people, their dominant hand may be a little bit stronger, so if it is not equal bilaterally, that can be a normal sign. Next is arm drift. Have the patient close their eyes and hold both arms outstretched with palms facing up. You are going to be observing for drifting of either arm.
And can you close your eyes and hold your arms straight out with your hands facing up towards the ceiling? Great.
Next will be leg strength. Ask the patient to push against your hands with their feet or their thigh and then have them pull back.
Can you push out against my hand and then pull back against my hands? Great, thank you.
This full assessment provides a structured neurological baseline. It's essential in identifying deficits that could signal stroke, trauma, or underlying pathology.